Hi, I'm Dr. Hesch, physical therapist at Hesch Institute in Aurora, Colorado. And my client flew in from Honduras today. He had had 12 visits of physical therapy there and had x-rays and an MRI and a scanogram to look at his leg length difference. And he had what was probably related to lifting furniture in December, in which he injured his low back. And in his pain drawing, he places marks in the region of the right low back sacroiliac area. And I'm going to demonstrate some movement testing of his pelvis. In terms of palpation, the pelvis is slightly asymmetrical, but ever so subtly so. I can load the pelvis on the right and I can create movement. The movement goes through the structure, and I can do the same thing on the left side. And now if you would lie on your stomach, please. And the PSISs are right here. Those are these bumps in the back of the pelvis. And the right PSIS is posterior. It's more prominent. And it's also lower, closer to his feet on the right side. Now when I try and create forward rotation, there's no movement. When I come over on the left side, I can take up the slack in the system. I can move it to an end point, and then I can spring and there's additional movement and it bounces right back. Another direction to test is inferiorly, and that moves well. I can see his heels bob up and down. And on the left side, we have the same phenomenon. And then when we look at vertical mobility, I can take up the slack on the left side and I can spring. I see his shoulders bobbing up and down. And when we come over to the right, I'm using the same amount of force, but there's no give whatsoever. So the entire pelvis is twisted about an axis somewhere on the left side that makes it appear as though the right ilium rotated backwards, but it's really a phenomenon of the entire pelvis. And this twisting pattern creates tension in this ligament. There's a ligament that connects the sacrum to the medial aspect of the sit bone, and that's called sacrotuberous. And this feels very, very hard. I cannot indent it. And on this side, I can easily indent that ligament. So I'm going to treat this and restore movement, and then I'm going to teach him a simple stretch that will help him keep the movement in that structure. So the only day he gets passive treatment from me is today. And after that, he'll be independent in self-treating this. Can I have you lay on your left side, please? And so what I'm going to do is, you can come to the side of me here, is I'm going to block movement. I'm basically pushing backwards through his leg and pulling forward on his ilium, pushing with this hand and pulling with my right hand. And I just take up the tension in the system. Good, I did that 10 times. Lie on your stomach, please. And so now I can take up the slack in the system. Now I can spring that ilium, and there's movement. And coming from underneath, I can now take up the slack in the system, and I can push it, and it moves, and it recoils. And if we look for that ligament now, I can now indent the ligament. So let's have you walk down the hall and tell us how you feel, okay?
It's hard to tell right now, but I feel released.
Where? What part of you?
The lower part of my pelvis, the
Okay.
lower part of my glutes,
Very good.
of this side.
Alrighty, let's move that stuff and also see how you feel in sitting. And I don't know if you were aware of a difference in sitting at all.
I would have to be sitting for a longer time period to see if I feel pain. But
Okay.
in the moment
Yeah, very good. Alrighty, so I'm going to lay on the table and I'm going to show the stretch that you will do.
Okay.
And I'll have you do this twice a day for a week.
Okay.
And then twice a week thereafter. So what you do is you sit on your bed, on the edge of your bed. Both feet come up on the bed. You bring your left foot to the left and you scoot your hips a little bit over and then you move the other leg over. So I'm going to keep my leg in, but I'm going to let it stretch off of the table. So my right leg is adducted and I'm letting it stretch down to the floor. And it's that simple. So you'll do this twice a day for 2 minutes, and after a week it should start, it'll stay corrected if you do it twice a week.
Okay.
All right, and we'll have you practice that. And I thank you for letting us film you.
Thank you.
I appreciate it. Thank you.